Hi, my name is Dr. Mike Smilanich, and I've been practicing restorative dentistry for 34 years. Today, I feel privileged to be able to talk to you about the use of KOVANAZE in your office in the clinic and some tips to administer it correctly and reach the high efficacy that we saw in our studies. So here we have a regional anesthetic drug without a needle, where we're numbing tooth number 4 through tooth number 8 with a spray, tooth number 9 through number 13. There's nothing else like that in our practices.
KOVANAZE comes in boxes and trays, and there's a slight assembly process required where a finger grip is snapped onto the barrel of the sprayer.
There's IFUs or instructions for use in the box. Please look at those. Some really clear steps have to be followed, and they have to be done methodically and correctly. Some of them are counterintuitive to the way we treat our patients in our office now, and your efficacy is going to depend solely on whether you read this and understand some of the steps we're going to talk about. When we talk to the patient, one of the things we emphasize is there's a very different sensation with this as opposed to an injectable. Drilling and injections are the patient's two greatest fears, so I think it's very important that you have a discussion about this technique with your patient before and offer this to them as an alternative. Managing a patient's expectations.
Letting the patient know that it's normal that their lips will not feel numb.
Letting them know that it's very likely that the roof of their mouth will be numb. It's a very, very effective ester drug, and the teeth have a deep anesthetic feeling. They feel like wood. The patients tell you that they feel like blocks of wood. And this is very foreign to patients. And for instance, if you select a patient that's very nervous and they want to be excessively numb because that gives them confidence, you'll have to coach them and explain that's not going to happen. Okay? Their teeth will be very numb, effectively numb for procedures, but their lips will not. The first step in administering the drug is sitting face to face with the patient. When we administer, I take the device out, I show it to the patient. Again, it's new, they haven't seen it. Two of the most important points in administering KOVANAZE effectively is to have the patient sitting up as opposed to laying down. Counterintuitive in the office. Secondly, the patient has a natural reaction to tip their head back when administering.
Their head needs to be level, and they need to be eye to eye with you.
The target of this whole administration is the nasal valve, not the nostril. Beyond the nostril, up where the cartilage ring is on the side of the nose, is the nasal valve. If you take your finger and push it on the outside of your own nose, you'll feel this. That's the target zone. When it's placed and at that angle slightly above parallel, a rapid spray is delivered. Unlike, again, counterintuitive, when we give injections comfortably, we go slowly.
When sprayed with confidence and speed, the device makes a characteristic psst sound that will let you know it was sprayed correctly.
There are 2 sprays administered 4 minutes apart. That allows the first spray to work.
When you approach the patient from the front, remember your nasal anatomy. If the spray is administered against the nasal septum, an ineffective spray will result. And again, if it's sprayed against the outside of the nostril, this is like spraying against a wall. It will run out of the nose. With the sprayer correctly positioned from the front, turn slightly to the side to assess that angle. Remembering that the inferior turbinate is very absorptive, very vascular, we want to coat that with the spray. It's about the size of an index finger in an adult. The medial turbinate's about the size of your pinky, so these are giant absorptive surfaces in the nose, and that's where the drug is being effectively absorbed. The 2 angles that we approach from are sort of to address this anatomy. So your first spray is going to be administered parallel to the floor, slightly above, and this is to saturate that inferior turbinate. The second spray at more of a 45-degree angle reaches the middle turbinate. Think of a sprinkler system where you're trying to put out a fire. It's going to be raining down on both of these radiator fins. So those 2 spray angles are quite important as a result of what that nasal anatomy looks like. There's a 10-minute wait after the second administration. 2 sprays, 4 minutes apart, wait 10 minutes. Tetracaine is an ester. It grabs onto the nerves and holds very tightly, but it takes a little while. If you jump that and try to perform the procedure quicker and you short it, you're not going to have adequate anesthesia. After those 10 minutes, like we do with every other procedure in our office, not specific to this, the way we test anesthesia is we begin the procedure. So we're calling it a test drill in the IFUs, but it's something we do every day. This test drill obviously we'll tell our patients, we're going to start this very slowly. I want you to raise your hand if you're uncomfortable at all. Again, coaching them, but understand that you should still have full sensation of your lip. Don't expect a lip paralysis like you get with the other injectable drug. If after the test drill, a patient is still sensitive, in patients over 18 years of age, a third spray can be administered. After that third spray, wait the indicated time before beginning the procedure.
If a patient doesn't achieve complete anesthesia, or the procedure becomes more involved, or some of the things that happen to us every day in our practice, you can go ahead and use what you always use in your practice. You could administer lidocaine or septicaine or whatever your typical injectable is. In closing, you'll find your patient acceptance and your enthusiasm and what I think is going to be an incredible addition to your practice. So much better if you just follow some very simple steps.
Remember, when administering this drug, the patient is seated upright. The patient's head should be upright as well and not tipped back, facing the patient eye to eye. The first spray is administered parallel to the floor, slightly above, and then a 4-minute wait before the second spray. The second spray is administered at a 45-degree angle, and then very importantly, a 10-minute wait before the test drill. Spray rapidly and confidently.
Liquid dripping out of the nose could indicate an improper spray technique and therefore may result in insufficient or shortened duration of anesthesia.
Remember, the nasal valve is the site of administration, not the nostril. Also remember, the angles of administration are very important for efficacy.
Remember these simple steps, and I really believe this will change your practice and the way you treat your patients for the better.